if you go to the dentist twice a year for cleaning for your teeth, then you can at least come to your eye doctor once a year, because we all know you can lose a few teeth, but if you lose your eye, it has much more greater consequences.
Wow. Welcome to Dayspring Life and Health Channel. Today we are privileged to come with your way again on our series in diabetes. We started talking about the complications of diabetes. So our topic today is going to be about how diabetes or high blood glucose affect your eyes. And to discuss this with me, I have Dr. Antwi-Nartey, who is an optometrist by profession. And she's been practicing for at least the last 10 years, schooled in New England College of Optometry, and currently in her own private practice in West Hartford, Connecticut. So without much ado, I also want to say that she is married and she has two beautiful children. And in her spare time, she does craft. I don't know how she finds the spare time to do that, but she's able to do arts and crafts. And she's also in the church local board of leadership. So I'm honored to welcome to Dayspring for the first time and not once. She's coming back. Dr. Antwi, welcome to Dayspring Life and Health.
Thank you so much. Thank you so much for having me.
Our first question is, how does diabetes affect anything related to the eyes?
So when it comes to diabetes, as we are all aware, it's as a result of increased blood glucose levels. In the body where we have our blood vessels, the vessel wall or the blood vessel wall is connected like this. And the component of the cells keeps the structure. So when the sugar levels in the body, in the blood increase, that disrupts the components of the blood vessel wall. So then what starts to happen, instead of it being connected like this, it starts to open up or fenestrate, and that is what lets blood start to leak out of the blood vessels. We call that losing the blood retina barrier, where you lose the integrity of the vessel wall, and so now you start to leak fluids, not just in the eye, but different parts of the body. But today we'll just focus on the eye. So that is one of the main effects of the increased blood sugar levels on the blood vessels itself. And because of this, it leads to a cascading of side effects, some of which we'll be discussing today.
All right, so that's a very good intro into that. Now, with that being said, can I ask, do you have to have a full-blown diabetes to have this process begin, or even with pre-diabetics, some of these changes are seen?
So usually when it comes to pre-diabetes, so our understanding of diabetes over time has changed or has evolved, where now some of the cutoff points we've dropped down a little because we start to actually see certain changes. Over time, in practice, I've diagnosed people first-time diabetes just based on changes in their eye, not just with how the blood vessels are looking, but even visual changes in the eye. But normally, when you start to tether into pre-diabetes or diabetes, once their changes are seen, or once we start to see actual changes to the structure of the eye, you shift from pre-diabetes into diabetes. Now, with how things stand, even with pre-diabetics, we still apply the same exam schedule, I should say, where that we need to see you after this time, even to pre-diabetics, because the blood sugar is, you're entering dangerous territory. And so whether you're tagged pre-diabetic or diabetic, we still manage you as if you've been diagnosed. Because, I believe when you're pre-diabetic, it's like, you're wanting to say, hey, backtrack, kind of get things under control before you go full-blown diabetes. So I'll say once there's any change or we start to see structural changes, it no longer is pre-diabetes, it's now diabetes.
Now, we know some of the complications of diabetes. We talk about nephropathy, which is affecting the kidneys and all those, and everybody knows a key word that we call diabetic retinopathy. Can you explain what that is for us?
So in the eye, changes to the retina as a result of diabetes is what we call diabetic retinopathy. And that ranges from a whole, umbrella of different types of changes. One of the main changes is grouped under two, proliferative retinopathy or non-proliferative retinopathy. And then under the non-proliferative retinopathy, we have mild, moderate, and severe. And those are changes that occur to the structure of the retina because of high blood glucose levels. And so I will just share with us an image here, just so that we have an idea of how things look when we talk about diabetic retinopathy.
Great.
So on the left side of the screen, a normal retina. As you can see, this is the optic nerve. These are the blood vessels. This is the macula. These are structures I want us to pay attention to. It'll come in handy. So optic nerve, macula, and the blood vessels. This is a normal retina. As we can see, everything looks good, is intact. On the other side, on the right-hand side of the screen, is what we have diabetic retina. So there are a lot of things going on. As you can see, again, the optic nerve here, but now there are a whole lot of blood spots everywhere. This is because, as we discussed earlier, once you lose the integrity of the blood vessel wall because of increased blood sugar, now you have the opportunity of blood to leak out of the blood vessels. And so you start to see this, and that is called diabetic retinopathy. When we come in the macular area here, we can see this bright yellow spot. This is leaking of fluid, also leaking through the blood vessels, that is now collecting over here. That we call macular edema, or clinically significant macular edema. When we come up here, we can see very, very faint blood vessels, also kind of wispy. This is an indication of what we consider, or what we call, proliferative diabetic retinopathy. So as you can tell from these two images, those are very, very distinct, or obvious changes to the retina as a result of diabetes. And that is what we call diabetic retinopathy.
Wow, that is very scary there. It's like one has a very clean image, the other one is like all splattered with blood
everywhere.
That's very scary. But in practical terms, how will somebody know? What are some of the signs and symptoms of diabetic retinopathy?
So most often when it comes to the eye, the one or the most common reason people come in is I can't see. And so how you would know, or how people know there are changes to the eyes or changes to the retina as a result of diabetes would be changes to the vision, where how you normally see things, people start to notice, oh, I am no longer able to read or drive or watch TV as clearly as I could before. And so they would come in and during the examination process, that's when we'll be able to find some of these things. So that's why most primary care doctors and most diabetes specialists, endocrinologists, always prompt patients, even before you get to that point of changes in the vision or visual changes, to keep regular eye exams, because there have been a few studies that have been done over the years, and one of the most recent research has shown that for non-proliferative diabetic retinopathy, when people are diagnosed with diabetes, within 5 years, 25% of those diagnosed with diabetes will show some form of mild non-proliferative diabetic retinopathy. And as time goes on, at the 10-year mark, 60% of people diagnosed with diabetes or who are diabetic will show diabetic retinopathy changes, mild. And then by 15 years, it has gone up to 80%. So if you've been diagnosed with diabetes within the past 15 years, or by 15 years, at least 80% of those that have been diagnosed with diabetes will show some form of non-proliferative diabetic retinopathy. When it comes to proliferative, like the image we saw where there's new blood vessels everywhere, there's more bleeding and all of that, what we find is that it increases also. By 5 years, we have about 2% showing that level of severe retinopathy. And then within 15 years, we have also about 15% people who are diabetic showing proliferative diabetic retinopathy. So we find that as time goes on, the instance or the incidence of changes to the retina as a result of diabetes also increases.
I see. So it's basically on a timeline, it increases. Now, do you say that if your blood glucose is under control, or you are very, very careful with your blood glucose levels, does it delay the incidence a little bit? Does it push it back?
Oh, yes, it does. It does. And so whenever we educate anyone who has diabetic retinopathy, what we always educate on is control. Control, control, control. Because we find that as you control your blood glucose, that is how you're able to push back how early you get retinopathy. So the key, of course, is making sure your blood glucose is under the level that your primary care wants it to be. Yes.
I see. Now, the other thing is, I was reading somewhere, it said, what about blood pressure? Most diabetics have high blood pressure too. Does high blood pressure complicate diabetes-induced retinopathy?
Yes, we find that those diabetics that have high blood pressure also have an increased incidence of diabetic retinopathy, because just high blood pressure alone, if uncontrolled, also leads to hypertensive retinopathy, which is a different slew of changes to the retina as a result of high blood pressure. And so if you have diabetes combined with high blood pressure, we find that the incidence or the instance of having diabetic retinopathy is compounded, especially if the hypertension is not controlled. And so we'll have sometimes incidences of both happening at the same time, diabetic retinopathy and hypertensive retinopathy, because those presentations, sometimes they'll blend together, but sometimes they're a little more distinct.
I see. So that makes it a little more serious then, especially since most people with diabetes also have hypertension. So yes, it's something we should actually look into very well and make sure we don't allow it to take the whole control. Now, the other question that I have is, do you see any demographic changes in terms of even let's do race and the age. What do you see about in your own patients, in your practice, and what the literature says?
So yes, there is a difference in terms of presentation, age and race, just also because of our dietary differences. We find that using other races, Hispanic, Latino, Black, African American, or even Asian races, we find that the incidence is a little bit higher, especially in Black and Latino communities, all because of our diet. When it comes to diabetes, let's backtrack a little. There is type 1 and type 2. What we are discussing, although diabetic retinopathy happens for both type 1 and type 2, the numbers are very different because type 1 is more genetic, more at an earlier age compared to type 2, which happens later, and it's more as we are learning more about diabetes, but it has to some degree lifestyle components to it. And so diet is a big factor. Diet is a major factor, where, heavy carbohydrate diet in, the African, Black African American communities, also in the African communities as well, and also in the Hispanic communities. And so heavy carbohydrate diet, high sodium content, high fat diets tend to cause there to be a higher incidence of diabetes in those communities as compared to the Caucasian or the white communities in America. And when it comes to age as well, just with, unfortunately, most things, as you get older, things start to go downhill. We find that age is also an indication where, as you go on later in life, that the incidence also increases when it comes to diabetes and diabetic retinopathy.
All right. So now, how do you manage or treat this condition?
So depending on the severity, as we had mentioned earlier, when it comes to diabetes, it's a spectrum. With retinopathy, there is mild, moderate, severe, under the umbrella of non-proliferative diabetic retinopathy, and then there is proliferative diabetic retinopathy. So when it comes to mild, moderate, and severe diabetic retinopathy, we normally again advise control. We work with the endocrinologist or the primary care provider who's managing diabetes to keep the patient in check so that we don't advance. Because and I'll bring again the image that I had showed earlier, when we get to the point where we get to proliferative diabetic retinopathy, where now you have the blood vessels growing everywhere, the fear when this starts to happen is you don't want to get to this stage. And what I'm showing you now, this image here is fibrotic proliferation. And so what you can see is new blood vessels that have grown here, and they've gotten hold of the retina to such a degree that it just pulls everything and just crimples everything. And when you get to this stage, unfortunately, you are 2 seconds away from blindness or from losing your eye completely. So whenever we see proliferative diabetic retinopathy, new blood vessels growing, the goal is to keep it, halt it there, so that we don't get to the point when everything just goes out of hand or goes haywire. And because when it gets to this point, usually there is very little, not much that the retina specialist is able to do. And so when we see diabetic retinopathy, proliferative disease, what they will do now is laser surgery. And this is an image showing laser correction for proliferative diabetic retinopathy. So all of these little burn marks here is all laser marks to pretty much stop the progression of the new blood vessels from growing, so that we can save this eye from getting to the point of no return. So although the laser marks that have been placed, pretty much you've lost that retina tissue, but you have saved this portion here, which includes the macula here, which is the center of the vision and is responsible for how clear we're able to see. So this, when we see this is, laser PRP, we call it, that has been applied to an eye that had proliferative diabetic retinopathy. So we do this so that it doesn't get that bad. Another form of treatment we do, and if we refer back to this picture, when I said remember this little area here, the macula, and then with all the yellow flecks here. So we call this macular edema, or clinically significant macular edema. So this is collection or pooling of fluid in the macular area. I'm going to show a picture showing a cross section of the macula. So again, on the right side of the screen here shows a healthy macula. As you can see, it's almost like a little valley. It dips, and then it comes. This is how a healthy macula is supposed to look like. When there's that much collection of fluid, or the yellow that we saw, this is how it looks like. And so this greatly diminishes your vision, how well you're able to see. People come in and they can't drive, they can't see, because there's this much fluid going on. So when there's that going on, diabetic macular edema, what we will do now is injections in the retina to help bring down this much level of edema, so that we can return to some degree of normalcy. So that is also another treatment we do, depending on how the diabetes presents in terms of the retinopathy. And so as we're saying all of this, with all these different changes, one might ask, okay, so how does it even show up, or how will I see, like in terms of real view, how do things look, or how would things look? This is an example. So normal view, if you have normal eyesight, this is how you would see things. But then when it comes to diabetic retinopathy, when you start to compromise the retinal tissue, you start to lose, or you start to miss little areas in your view. And so this is, a simulation of how vision is for someone who has diabetic retinopathy. So with treatment protocols, when it comes to diabetes, it's either injections to bring down the swelling in the macula as a result of macular edema, or laser to prevent further growth of new blood vessels. Also, that we do not get to the point of the fibrotic changes that comes, because when it gets to this point, usually there isn't much that can be done, and the patient is close to losing eyesight completely as a result of diabetes.
Wow, this is more serious than I thought. That picture of the spots in the vision that cannot be seen, it's wow. It gives you actual warning that something is up there. If you don't stop this, you're going to eventually not see.
Exactly.
That is great. All right, now my other question then is, how can this actually be reversed? I know even before you answer that, in relation to diabetic treatment, I think you probably hinted on that. Mm-hmm. If you have a very good diabetes care, if you eventually take care of your diabetes, can you reverse some of the harm that is going on in your retina?
Yes. So I'll bring again the image that we were looking at earlier that gives us all the different levels of retinopathy going on. So when it comes to diabetes and diabetic retinopathy, when you've had diabetic retinopathy, mild retinopathy usually is just blood pooling, spots of bleeding, pooling in the retina. That is very reversible. Just by controlling your blood sugar, you're able to, the body within usually a span of 3 to 6 months will reabsorb all the blood as long as the sugar levels come under control. Even with mild disease, again, control, your body will reabsorb all of it. And not needing external intervention, except, taking your diabetic medication, insulin if you're on insulin, dietary changes, bringing your sugar down, preventing the fluctuation of your blood glucose level. When it comes to macular edema, like we looked at, once you have the fluid building up in your macula, it requires external intervention, injection into the eye, but that will bring the swelling down. And also, I have seen patients whose macular edema has been resolved. The only thing, or I guess when you get to the point of no return, where you don't resolve completely, is when you get to the proliferative stage, where you start to grow new blood vessels. And if I magnify and zoom in right around here, you can see all the different wispy blood vessels. So when you get to proliferative stage, unfortunately, that is when laser has to be done. And so once they apply laser in whichever area in the retina they apply the laser, that retina tissue has been compromised, so that you can't return back. So proliferative disease in diabetic retinopathy is the point of no return. That's the only point where we are unable to bring you back to where you were before. But if it's just mild, if it's just moderate, a few spots of bleeding, even leaking of fluid, once they apply the injections, it will bring it down. Except proliferative disease, that is only when we have to do laser. And with the laser, unfortunately, we can't return the retina back to what it used to be. So all things, we can get your retina back to looking normal after resolution, except for proliferative disease when they do the laser.
Wow. So then the key here is to make sure that your eyes are checked more frequently, so that if anything has at least started, you can stop it before it gets to a proliferative stage, right?
Mm-hmm. Yes. So normally, depending on the level of retinopathy, that determines how often we see patients. Sometimes it could be monthly for those that are receiving injections. For most retinopathies, we do 3-month checks to make sure that we're monitoring for any changes, and also if they're being controlled properly or they've gained control, then we're able to assess how quickly the eyes resolve or how quickly the retinopathy resolves. And then for those that are doing great, they're diabetic, but their numbers are great. Their A1C is under 7, 6, even 6. And I have some patients who brought it all the way down to 5, and there is no indication of retinopathy, a normal appearing retina. We do yearly exams because there isn't much that we're following that we need to manage. But whenever there's any indication of retinopathy, then we either do every 6 months or every 3 months, or for those that are receiving injections, every month.
Great. All right. So now this is very great and useful information. Now, apart from those who have been diagnosed, do you suggest that at least everybody gets a yearly eye exam?
Yes.
Okay.
So the thing with the eyes is that most often we kind of take it for granted, because you wake up, you can see, so you think everything is all right. But it's a shock how many conditions there are of the eye. A colleague of ours counted, and there are over 250 different conditions that affect the eye. So we always advise yearly exams. A joke that I tell my patients is, if you go to the dentist twice a year for cleaning for your teeth, then you can at least come to your eye doctor once a year, because we all know you can lose a few teeth, but if you lose your eye, it has much more greater consequences. So
I don't even think about it that way. You can sacrifice some teeth, but you can't sacrifice an eye.
No, because although you have two, even if you lose one, the consequences are still. So that's what we always advise, that always yearly exams, because if everything is fine, what we'll say is, okay, we'll see you next year.
Wow. Okay, the next question we're about to wrap up is, what specific foods or food groups do you suggest for people to boost their eye health, and in particular also for patients with diabetes?
So when it comes to foods, as we all know, avoid, heavy carbohydrate diets, also the fatty foods, also, high sodium, salty foods, processed foods. Avoiding all of those is just healthy for your overall health. But when it comes to the eyes, what we advise is, foods that are high in antioxidants. So spinach, kale, collard greens, beets, anything that has a high antioxidant content is excellent for the eyes. Also flaxseed, omega-3s, the healthy fats, also very, very good for the eyes. And then overall, again, cutting down on your carbohydrate intake, cutting down on your processed foods, just to maintain a healthy body, because, a healthy eye will reside in a healthy body. You could have a great pair of eyes, but if your body is giving you problems, what's the use? And so just making sure that your overall health is, tip-top shape, and then that will also in turn translate to a healthy eye.
Thank you. Now, do you have any suggestions for vitamins too for eye health? I have had patients come to me and ask, what kind of vitamins should I take? Some with suggestions from whoever told them. Mm-hmm. But when you pick the vitamins and you look on the bottles, you see that they're just regular multivitamins. Do you have any unique ones?
So there are specific vitamins that are good for the eye. Usually, before, I would say, there would be vitamins just like, the Centrum and all of that. But most are not tailored specific to the eye. But now, of late, there are pharmaceutical companies that have taken up the challenge and are making vitamins specific for the eye. One that I recommend to my patients often is called MacuHealth, MacuHealth. And what that contains, so through research, we have found that in the macula, there are three components that is not found anywhere. There is lutein, zeaxanthin, and mesozeaxanthin. Normally, lutein and zeaxanthin we are able to find in our diet by eating egg yolk, milk, things like that. We're able to get those vitamins in our body. The only one we can't make or get from food, I should say, is mesozeaxanthin. And so there are some companies through research that have been able to to formulate that. And so I recommend MacuHealth a lot, not just for those who have, issues with their macula, but just to maintain the overall health. And I've had, testimonials from patients who've taken it, and then they'll come the following year and say, wow, I've noticed that I'm able to appreciate, even contrast, how well you're able to tell the depth of color. You'll be surprised as time goes on when you start to lose that. Another company also makes eye vitamins they call Eye Promise, like EYE Promise. And they also have a slew of different types of vitamins from that company. Some, for maintaining the macula, some for dry eye. But those two companies, I would say, would be what I recommend. Because if not, most often what people are taking is just, just a very minimal benefit to the eyes, and it's just expensive vitamins. But
very
that's
expensive. I have some names, but I don't want to be in trouble with.
I know.
So I'm not going to mention, but very expensive eye products. And when you look on the bottle, all they got is vitamin A.
Exactly.
Maybe lutein. And that's all you get. So I'm going to look those up, and if I'm able to find them, I'll put links on the description of the video. And do you have some in your practice setting too?
Yes, we do. We stock these vitamins so that those that need to purchase them, they're able to get it directly from us. Just because of getting it directly from the manufacturer, usually the pricing difference is much less in our office than or in doctors' offices than you would find on Amazon or even on the website. Well,
good to know. So I'm going to hook up with you and see if I can get some for people who reach out to me on the channel for that. And those people who are local, they are going to have to find out where you are. And that actually leads us to our next question. Talk about Eyes on Park and what you do there, and how can people get to you if they need to talk to you or if they need to come and get their eyes checked?
Okay, so Eyes on Park is a private optometry practice, full service. We do everything eye related except surgery, because eye surgeries cannot be done in an office. It has to be done at a surgical center. But from, checking eye health or the different conditions of the eye, managing eye conditions, to fitting contact lenses, all the different types of contact lenses, specialty lenses, to providing eyeglasses. We're able to, serve our patients with all of that. We are in West Hartford, Connecticut, on Park Road, hence the name, Eyes on Park. And usually we're able to, accommodate most of our patients, those that need, our help. It's myself and then another doctor that work there seeing patients.
I see. And if anybody wants to get to you, I will collect all that and put it in the description so that if somebody wants to email you, because I'm pretty sure there are some people who are going to watch us from far away. They can't come to West Hartford. But those who are local in Connecticut, they got to come and check you out, including me. I'm going to be there. All right. Before we end this video, what would you like to say to viewers?
The closing remarks I'll have leaving with everyone is take your eye health seriously. Make sure you're getting your yearly eye exams, because that is very, very important. That's the only way we're able to keep track, monitor, and also detect changes that happens to the eye. If you've been diagnosed diabetic, then maintaining your sugar levels, making sure that you're following the treatment protocol. If it's insulin, making sure that you're taking your insulin and you're not either spiking or dipping when it comes to your blood sugar. That will be the only way we can maintain your eye health for the years to come without any complications.
I want to say thank you also to Dr. Antwi-Nartey for her time and for such an insightful discussion, very detailed. I'm happy our viewers got to see what I saw for myself. And hopefully those with diabetes are going to take it more serious and also put more seriousness into their eye exam and eye health. As I warned her earlier, it's not going to be a one-time deal. I'm going to get her again, including even her husband, who is also in the medical field. All right. Thank you, doctor.
Thank you. My pleasure.
Beloved, I wish above all things that you prosper and be in health, even as your soul prospers.